Hello and welcome to today's webinar. My name is Andrew, your WebEx producer, and I'll be in the background answering any WebEx technical questions. We have a few housekeeping items before we get started. If you experience technical difficulties, please send a message to the WebEx producer using the Q&A panel. You may also dial 1-866-779-3239 and receive technical support assistance. With that, I'd like to introduce your first speaker for today, Trina Williamson. You now have the floor.
Thank you, Andrew. Good evening, everyone, and welcome to the last of many presentations that we have done over the past few weeks regarding the future of healthcare in Chestertown. I'm Trina Williamson, the Regional Director of Communications and Marketing for SHORE, and I will be serving as the moderator for this meeting. Joining me for the presentation is Ken Kozel, President and CEO of SHORE, Dr. William Huffner, Chief Medical Officer, and Dr. Walt Atha, Regional Director of Emergency Services. The flow of this evening's meeting will go as follows. As an FYI, all attendees for this presentation are in listen-only mode. If you have any questions or comments at any time during the presentation, please type them in the Q&A box, which is located on the bottom right hand of your screen. Please also know that there is a dedicated section on the SHORE Regional Health webpage with more information, as well as a place where you can provide further feedback regarding plans for Chestertown. We encourage you to visit these pages at shoreregional.org/Chestertown. With that, I will turn it over to Ken Kozel. Ken?
Thank you, Trina. And good evening, everyone. Thank you so much for taking time out of your busy schedule this evening to spend a little time with us and learn more about the Chestertown models of care that we're implementing here at SHORE. Before I do, as I look out my window, it looks like a storm's about ready to hit, so I'm hoping we can get tonight's session in without a lot of technical difficulties. So if you hear me going a little faster than usual, that's my intent, is to try to get through the entire presentation for you. As Trina mentioned, we've had a number of these throughout the county, and I've just been so pleased with the response and the feedback and the positive comments that we've been receiving around our new models of care. I can't thank you enough for the support that you've provided us, and I look forward to helping our team implement these models of care in the very near future. But before I get started and share some information with you about what we're planning for Chestertown and Kent County, I thought I'd take a step back and just talk a second about COVID-19. And the impact it's had on our team and on our organization. I think everybody on this call realizes that COVID has been an incredibly tough time for our team. It's been challenging for our organization and really for the state and nation. And I know that everyone on this call knows how hard our team works to try to address the demands that COVID has required of us. And our team at SHORE Regional Health are truly healthcare heroes as they provide care for our patients every single day. But in these challenging times, they've really stepped up above and beyond and just have provided exemplary care for our community. And that's what we're all about at SHORE. But what I'm here to share with you today is that even though we're the hospital system caring for COVID patients in our emergency department and as admitted patients in our system, and that number has totaled a little over 1,000 patients since COVID began, we also have experienced the responsibility of being the anchor institution in our communities. And by taking on that responsibility, we've gone outside of the hospital walls, and we've done some things that show that we are a community partner and that we are the healthcare system of choice for the Eastern Shore. I want to mention a couple of things specifically that we've done to exemplify that, and hopefully you'll see that it complements our mission of creating healthier communities together. So a couple of the ways that we've stepped out is that we've started by testing our community for COVID-19. Early on, that was an important part of diagnosing who had COVID. And then once we were able to, we worked closely with our health departments to ensure that those patients got the appropriate care and treatment needed, from quarantine to isolation, to doing tracing, to ensure that any others that came in contact had access to the right care and treatment as well. That was a critical step of ours, and testing was an important part of that process. To date, we've tested over 20,000 people within the SHORE Regional Health System just for COVID-19. So we've stepped up and stepped out and provided testing for our community. But we've also provided vaccinations to our community as well. And it started with our team members, And I'm proud to say that we've got over 65% of our team vaccinated at this point. But it also includes our patients and our community members. And as the governor of the state of Maryland went through the various stages, our team provided those vaccinations each stage along the way. And we continue to do that on behalf of our community. But we've also set up mobile vaccination sites. And this is a process that, in collaboration with the system, we've actually rented vans and gone into vulnerable parts of our community to offer the vaccine to our community members who likely would not have received the vaccine. We have done this at least a dozen times so far over the past month or so, and we'll continue to offer these mobile vaccination clinics to our community in all 5 counties we serve. And we'll work collaboratively with our health departments and our health officers to make sure that we're addressing those vulnerable populations in our community. And then finally, we've implemented a monoclonal antibody testing protocol. I believe everyone knows that if you do get COVID and you are positive and start to show signs and symptoms, oftentimes the monoclonal antibody treatment can be used as a means of reducing the severity of COVID and ultimately trying to prevent ER or hospitalization visits, as well as potentially even death from COVID. So we've been able to implement that monoclonal antibody treatment protocol. And we've done that at Shore to date. We've done that about a dozen times, over 24 times for patients in our region. And we'll continue to offer that treatment for our community. So stepping out of the hospital-based care, working towards supporting the true needs of our community throughout this pandemic, and really becoming that anchor institution is what we're all about. And I share that example with you because as we talk about reimagining Eastern Shore healthcare, and as I share the models with you, you'll get a sense that it's not just about hospital care any longer. It's an important component, but so is the health and wellness of the community we serve. So making that connection between what we've already done with COVID and what we're about to do in Chestertown and in Kent County, I hope demonstrates our intent and our efforts to achieve our mission. And before I get started with the presentation today, I wanted to take a second to introduce you to some of our board members that are on this call this evening. These are our board members from Kent County, and I'd like to say hello and welcome to Mr. Garrett Falcone, who's a new board member at Shore. You may recall Garrett worked at Heron Point, and Garrett is now a member of our board of directors at Shore. Mr. Bill Knoll is also a member of our board, and Bill's been on the board for several years now, and he chairs one of our board committees and is just an exemplary board member for our organization. I'd also like to introduce Dr. Chris Perry. Dr. Perry is a urologist that works in Chestertown, and he's on our board as the physician representative for our Chestertown community. And then finally, Mr. Sam Shoge. Sam's been on our board for a couple of years as well, and is a member, a resident of Chestertown, and works in the Midshore region and really provides excellent feedback and insight to our board. So welcome to our Kent County board members, and thank you so much for being on today's call. And we appreciate your contributions to our board. I'd also like to take a second to introduce Mr. Dennis Welsh and Ms. Laura Wilson. Both Dennis and Laura couldn't be with us tonight, but Dennis and Laura are the 2 new executive leaders that will help implement our models of care in Chestertown. Dennis comes to us from Maine, where he spent over 16 years in the critical access hospital space, from COO to CEO and president of a critical access hospital. He's got exemplary experience in healthcare and is really looking forward to bringing his skills to the Eastern Shore. Dennis is actually traveling today and tomorrow on his way to Chestertown, where he'll take up residence in our community. He's been working for the last 3 weeks or so through technology and through WebExes, but Dennis will be making his way to Chestertown and will start in-house with us next week. And Laura Wilson, as Director of Rural Health Transformation, will complement Dennis and combine to form the leadership team that will help implement these new models. Laura has served the past 6 years as Executive Director of the Maryland Rural Health Association. She is based in Centerville, Maryland, and she has developed incredible partnerships with our community leaders and our community providers from the Eastern Shore to Annapolis and all throughout the state of Maryland. One of the other things Laura's an expert at is grant writing. And a lot of the things that we're going to talk about tonight could benefit from getting grant funding at the state and federal level. So we're really looking forward to having Laura and Dennis as part of our leadership team. Hopefully you've seen our advertisements in the local papers, and we'll get a chance to meet them in person when they arrive in Chestertown. So I'm very excited about that, and I'm hopeful that they continue to take this vision and help us execute. So some of the takeaways that we'd like to have for you today, if I could boil this down onto one slide and ask you to walk away with nothing else, I think this slide tries to encapsulate exactly what we're asking. And that is that the three important takeaways would be, number one, that our multi-year plan officially begins on July 1st, when we'll offer hospital-based care and services as defined by the Maryland Rural Hospital designation. Number two, starting now and over time, we're developing an Aging and Wellness Center of Excellence on the hospital campus, which will offer programs and services to improve the health and wellness of our community. And third, both the hospital and our aging and wellness programs will address the unique needs of our rural community and the unique needs of our elderly and vulnerable populations. And it will serve as a sustainable model for years to come. And I think back to our conversations from years ago, and I think recognizing that if these are the three takeaways that work, then we'll align our thoughts and our plans with those of the community. So specifically, the University of Maryland Medical Campus at Chestertown will be Maryland's model for how to provide best-in-class healthcare in rural regions, where we'll serve as the example for the nation's rural healthcare systems to follow as well. And I wanted to share with this group this evening that we used a variety of information to generate our plan. It wasn't just our SHORE team sitting down and creating it. We really pulled a lot of information from a variety of resources to generate our vision for the region. And the first and important resource we used was the information associated with the NORC report. The NORC was a consultant that was commissioned by the Maryland Healthcare Commission to come into Maryland and specifically Kent County and bring their expertise for what other healthcare systems across the country have used to facilitate hospital-based care along the critical access hospital templates, but also to look at the unique needs of Kent County and complement what they've learned from elsewhere in the country and apply them to the uniqueness that is Kent County and Chestertown. So the NORC report served as a vital resource for information for us to generate our vision. But we didn't stop there. We also listened to our community in a variety of different ways. We received a variety of community needs assessment reports. These reports are generated by Shore Regional Health or other agencies like the Kent County United Way. And to get the information in these reports, we asked our community members, what's most important to you about healthcare? What do you think we do well or things that we need to do better within our specific communities of Chestertown and Kent County? And how would you prioritize those requirements? So taking that information from our community and those needs reports, which focused on healthcare and non-healthcare related activities, really helped us get a complete picture of the needs for Chestertown and for Kent County. And then finally, we looked and examined ourselves at some of those best critical access hospitals around the country. Those are hospitals that we intend to model the Chestertown Hospital after. And we know that across the country, there are many that are succeeding and doing incredibly well, but there are others that have had to close because they weren't able to sustain their operations. The statistic I like to talk about is over the last 10 years, more than 150 critical access hospitals have closed across the country. And if you fast forward 10 years from now, it's anticipated that at least another 150 will close as well. We certainly want a model that's sustainable for Chestertown and Kent County. So we looked at those models that are succeeding. What services did they offer? What hours of operation? What benefits, what features, and how were they complemented with other parts of care to make them effective? So we pulled all of this information together in the form of today's vision and today's report, and we plan to launch our new approach to how healthcare is accessed and delivered in our community based on that information. But I think the important thing I wanted to share tonight is that we also listen to our specific community members and their feedback. We listen to you in a variety of forums, from the membership associated with Save Our Hospital group and from other members and other constituencies, including our medical staff as well. And we've listened and we've learned that in order for Chestertown and Kent County to thrive as a community, and with an ambition of creating a retirement destination for many across the nation to come to our community, we recognize that we need a hospital to support that level of care. And we listened, and through the help with Save Our Hospital and through the vision that we've established today, I think we've accomplished that goal. But we're not going to stop there. Part of our intent with this plan moving forward is to create a community advisory council where we'll continue to seek feedback, evaluate our progress, measure our success, and come up with new strategies that may help us ensure that we are sustainable and that we thrive. That's the important part with all of this, is that it's sustainable and we continue to be able to operate effectively for many, many years to come. So our commitment. Our Chestertown Hospital will remain a key component of the local healthcare delivery system, and together we will create a healthier Kent County community. For the University of Maryland Shore Medical Campus at Chestertown to thrive, though, we know we must partner to create a sustainable model that meets the needs of the community and the requirements of the state. And I'm confident that when we work together with the state, our local community, and our healthcare system, that we will accomplish this together. So meeting the needs. This slide tries to depict for you, in essence, our intent is to provide the right care at the right location at the right time. It's critical that we do this because that's how we're going to thrive. You can see on this slide some of those key components for what's important for providing great care in Chestertown and in Kent County. And again, it's national best practices, state endorsed solutions, and these state endorsed solutions are by our two healthcare regulated agencies, and getting the local input from you, our community, to help formulate these plans. I'm going to go into each one of these bullets in a minute, but I'll continue on with our vision. So at the end of the day, what are we really trying to hope the outcome of our plan is? And that is to be the provider of choice for our community. We know today that many in the community use Shore Regional Health for a variety of your healthcare services, but we also know that many of you are leaving Kent County for your healthcare. And our intent is to change that. Our intent is to build confidence and trust in each of you and have Shore Regional Health, and specifically our hospital and services in Chestertown and Kent County, be your first choice for care. We want to be your provider of choice. We want you to know that Shore Regional Health is there for you whenever you need it. And it doesn't matter if it's a primary care visit, a referral to one of our specialists, maybe it's an education class in our conference center, or maybe it's a home visit by one of our mobile wellness team members, or maybe it's a hospital stay where you're an admitted inpatient in our hospital. Each one of these encounters will help build confidence in the quality of care we provide and build trust that we're there for you when needed. We believe that this will earn the community's confidence and the distinction as your provider of choice. So where are we on that journey? That journey is going to take us far, we hope, but now we are in the process of finalizing our delivery. We know that we've got to work closely with our state agencies to execute on this plan. We have to be aligned with their expectations, and we're almost there. The final vote will take place in May, where we expect to get their full support for this plan. But secondly, we also know through these encounters that we will get more information back from our community. And with that information, we'll refine our approach. We'll take our information and tweak our plan so that it has your feedback and input, and that we have your support moving forward. And then finally, we'll take our plan and move forward as partners to ensure our success. We'll establish measurable objectives, and we'll meet regularly to assess our progress. And this one slide tries to depict exactly what we're thinking with regard to the two models of care for the new Chestertown, Kent County vision. In its essence, the first model of care is the blue circle in the middle. It's the Maryland Rural Hospital. And you can see in the circle, it defines July 2021 as the date when we'll enact that new designation. And I've got a slide coming up that walks through the specifics of the Maryland Rural Hospital. And as we mentioned, it's a lot like the critical access hospitals around the country. But in addition to the Maryland Rural Hospital blue circle in the center, the other 5 circles surrounding it form the programs and services that go with the Aging and Wellness Center of Excellence. The Aging and Wellness Center will complement the hospital-based care and really is designed to promote health and wellness in our community. Each one of these circles represent a different service or a different strategy, but collectively, they will be designed to promote the health and wellness of our community. And again, I have a slide for each one of these that just give you some more detail around what we're talking about for each of these services, but ultimately they pull together to form the Aging and Wellness Center, which again will complement the hospital-based care and really serve as a model for the state and for the country for how to provide excellent rural health care in a region like ours. But let's go through some of the specifics, and there's a lot of detail on these slides, but I really wanted you to have a sense of exactly what we're talking about. I'll go through them briefly, and certainly we can answer any questions you have after that. So when I speak of a Maryland rural hospital, the state of Maryland in its current model does not account for a rural hospital in a community like ours. In essence, you're an acute care hospital within the state of Maryland, and you follow similar rules, similar guidelines, similar objectives. Well, we felt like we are unique with regard to Chestertown and Kent County. Rural is unique, and we needed to develop something a little bit different, but staying in the same lanes as the other state agencies and the other hospitals within the state. So through the hard work of our legislation and our healthcare agencies, we've created the Maryland Rural Hospital, and it's modeled after critical access hospitals around the country. And critical access hospitals are just hospitals that are smaller in size. They're licensed for up to 25 beds. They see patients that are mild to moderately complex. And by that, I mean, when you come into the hospital, you typically have a length of stay, or the amount of time you spend in the hospital is about 4 days. If you spend more time than 4 days in there, then chances are you're that complex patient that needs a higher level of care. If you stay 4 days or less, you're then that mild to moderately complex patient. So that's the type of patient we're looking for, is that mild to moderately sick patient that has a length of stay of 4 days. And while you're in our care for those 4 days, then we will provide the services that are listed on this slide. We'll have a full service emergency department that'll care for you just as it does today. We'll have inpatient beds that will allow us to flex up to 25 beds. Today, our license is at 12, but with this new model, we're allowed to flex up to 25, and that will account for those patients that are leaving our community and may want to come back to receive their care in Chestertown. So we'll have flexibility to do that, and you can see that that's in blue. So that's a little bit different from what exists today, but we'll complement that with hospital-based care and emergency department care. But some of the other unique features that we'll add to the hospital-based care is we're working for designations, both in our emergency department and for our overall hospital, that will share with our community and indicate to our community that we have the special skills, training, and resources needed to care for a pretty significant part of our population, which is our elderly population. We know that in Kent County, more than 25% of our community is 65 and older. So by having these special designations, like a geriatric emergency department designation or an age-friendly health system designation, they tell our community that we have the training, the resources, and the tools and techniques to care for the unique needs of the elderly. So we'll implement these types of designations over time, and again, build the confidence in the community that we have the resources to care for you. One of the ways we're going to need to do that is to hire a fellowship-trained geriatric emergency medicine provider. This doctor will come on board with us in August, and she will help us develop the geriatric emergency department designation, the specific steps needed to meet that designation and ensure the community is aware that we provide great care. But we're going to complement that with what we're calling an MSTAT program, and that stands for Emergency Medicine Stabilization and Transport Team. This extra team of resources, extra physician and extra nurse team, will be available as needed to respond to those patients that may start to get critically ill, either in the hospital as an inpatient or walking into our door as an emergency room patient. This team can be utilized to support the care of that critically ill patient and stabilize that patient as best we can. And then once that patient is stabilized by this team on site in Chestertown, then a determination will be made as to whether or not it's safe to keep that patient in Chestertown, or if that patient needs to be transferred to a higher level of care. This unique and innovative approach is really something that we're going to start in Chestertown, but we find that it's going to add value to our other facilities as well, both our FMF in Cambridge and our emergency center in Queenstown, as well as the hospital in Easton, because not all of our facilities can care for all of our patients that we see. We transfer out a number of patients to a higher level of care because there are organizations that are better equipped to manage those complexities. So here we have the resource of the MSTAT team. They'll be able to respond as needed and care for that patient who is in critical need. That's an additional feature that we'll have. And again, we'll pilot that and have it up and running in July when we open the Maryland Rural Hospital designation, but also have it available in other parts of our region. We'll also have surgical capabilities within the hospital, as we do today, with a variety of inpatient and outpatient surgical procedures. And we'll use telehealth capabilities to have access to specialists. So if you're an ER patient and we're trying to determine if you should be transferred to a higher level of care or not, we can use telehealth capabilities to connect to a specialist, perhaps in Baltimore at the medical center, to have that conversation provider to provider, doctor to doctor, to make sure that the right care and treatment is being provided, and to assess whether or not that patient is safe to stay in Chestertown, or if they do in fact need to be transferred to a higher level of care. We'll also have that same capabilities for our inpatients. Having those consult capabilities for the inpatients will help ensure they're getting the right care needed, and will help ensure that they get discharged safely to the next location. So these are all services and features of the Maryland Rural Hospital. Again, some of the uniquenesses that we're going to provide are in blue, and it will really serve as the destination point for hospital services in Chestertown and Kent County. That's the first of the two models. The other models we're talking about now is the Aging and Wellness Center of Excellence. And this model is really going to complement the hospital-based care by providing programs and services to keep you healthy and well, ideally to keep you out of the emergency room or to keep you away from being admitted into our hospital. Our mission at Shore is creating healthier communities together. And by fulfilling this Aging and Wellness Center and getting it operational, we'll be achieving that vision as we care for the community in a more healthy and meaningful way. So these 5 bullets on this slide are components of the Aging and Wellness Center, and I'll go through each one of those with one slide, and I'll walk you through the latest and greatest and our thoughts on how we're going to execute on each one of these strategies. So let's start with primary care, behavioral health, and dental services. Again, when we looked at our information from the NORC report and our community needs assessment, one of the most defined needs we heard from was access to primary care, behavioral health, and dental services. And we at Shore have, we've implemented a primary care program, but quite honestly, we've struggled with recruiting and retaining primary care providers. We are blessed to have the providers we have today, and Dr. Ross and Dr. Belanger, but we struggle with keeping enough primary care providers to ensure that the community need is being met. What you'll see on this slide is Chestertown Community Health's logo. And our strategy moving forward for addressing the needs of primary care, behavioral health, and dental services is to collaborate with Chestertown Community Health. Chestertown Community Health has been established for over 40 years with Midshore locations in Caroline, Dorchester, and Talbot counties. They have a staff of more than 200 employees, and they serve over 30,000 patients each year. They are an important provider in these levels of services, and I think by collaborating with Chestertown and developing a federally qualified healthcare center in Chestertown, we will be able to draw, attract, and retain these providers in our community and provide these important foundational services to promote health and wellness. The second strategy is to develop a mobile wellness team and provide home-based care for our community. And when we looked at community focus groups, those focus groups indicated that one of the community's top 4 concerns is the need for care coordination, case management, and patient navigation. What do we do with our patients when they're in the hospital and getting ready to be discharged back to home or back to another care facility? How do we ensure that that's a safe transition? And once they get to that destination, how do we ensure that they have what they need to thrive in that new environment and that they've got the resources to support their health and wellness? Well, our plan is to implement this mobile wellness team. This team of new team members that are part of Shore Regional Health will work collaboratively with the Kent County Health Department to do assessments of patients while they're in their homes, to make sure that they have the support and resources needed to stay healthy and well, but also to prevent that unnecessary emergency department visit or that hospital admission. And you can see on this slide, the bullets reflect the services that this mobile wellness team will provide. They'll either use telehealth to have mobile visits in your home and do assessments that way, or come to your home and have things like home safety inspections, or help walk you through your medication plan to make sure that you understand what medications you're supposed to take and when, and help you manage that so you're comfortable with doing it on your own. They'll do screenings and diagnostic testings with you and make sure that you have access to those resources to be able to make sure that they're done. Again, all with the intent of making sure that you have resources, you stay healthy and well, and ideally you stay at home for the care and services that you need. So this mobile wellness team is an important part that will complement primary care, dental, and behavioral health services, but provide these services in the home where possible. The next specific program under the Aging and Wellness Center are specific aging and wellness programs. And as you can see on this slide, adopting these programs, I think, will provide some of the resources that our community has asked for specifically. And it's going to start with having a new geriatrician practice, home-based in Chestertown. We're in the process of recruiting a geriatrician, but that physician, geriatrician, will open their practice in Chestertown and serve the Midshore, again, to complement the unique needs of our elderly in our community. But we know that's not enough. We know access to other specialists are important. And the second bullet on this slide walks you through what specific specialties we intend to provide. This will be a combination of in-person visits in our clinics at the Aging and Wellness Center adjacent to the hospital, but they also could be telehealth visits. We found with COVID, we've done over 25,000 telehealth visits since COVID has been launched. We found that the community embraces this technology, and where appropriate, it could be used to address some of the access concerns that we have and give us access to these unique specialties for our community, so you don't have to travel outside of the community to get those services. And in collaboration with the University of Maryland School of Medicine and our University of Baltimore partners, that will help us provide these services to our community. I want to stop here for a second because I'm not sure if those on this call tonight are aware, but we heard the other day from our state senator, Senator Hershey, and our delegates that work at the General Assembly, Delegate Christ, Delegate Jacobs, and Delegate Ahrens, that they were able to secure very specific funding from the state for this type of program and these types of services. Specifically, they were able to garner $2 million a year for 3 years, starting in fiscal 23, that can be earmarked for programs and services exactly like this, addressing the access issue that communities like Kent County face, bringing specialists and providers to our community, either in person or through telemedicine, but having access to these specialists. And the funding that they have been able to secure for us will be used to create these kinds of connections with our community. So I can't thank Senator Hershey, Delegate Jacobs, Delegate Ahrens, and Delegate Christ enough for raising their hand and saying, hey, what about the Midshore? We have the same challenges as other parts of the state. We want to work with the University of Maryland School of Medicine to provide these services as well. So thank you to our elected officials. We appreciate your support for our community, and we'll use those resources and be wise stewards of that resource for the benefit of our community. But in addition to the aging programs of geriatrician and having specialists associated with our community, we're also going to have wellness programs, and we'll see partnerships evolve with Upper Shore Aging and the YMCA that will promote programs and services to promote health and wellness in our community. So exciting things happening, all complementary to the Aging and Wellness Center of Excellence and unique strategies to support the health and wellness of our community. So that's 3 of 5. The fourth is health education and financial stability. We understand that health literacy is critical to good health. We know that offering unique and creative ways to obtain and read and understand and use health information to make good healthcare decisions is part of the responsibility we have as our community provider. Services that are part of the Aging and Wellness Center that we'll provide include things like a dedicated health educator. This again will be another new employee for Shore Regional Health, whose responsibility will be to work with our community partners, specifically the health departments, as well as Upper Shore Aging and others, to really define what the community needs from a health education perspective, and then to facilitate our partners in providing those resources to our community. We'll likely have a conference center within the Aging and Wellness Center that can be used for these types of services. We'll use WebEx meetings like this to share information, but we're intending to define what those unique needs are for Chestertown and Kent County, again, likely back to the community needs reports, and then provide those services through this dedicated health educator. What we found in the past is that when we've had grant funding available for this type of program, oftentimes the grant dries up and so does the program. So by providing resources in the form of a health educator specific to this function and responsibility, we're going to ensure that we provide this service for years to come. So an important part, again, of educating and fulfilling the needs of the community. But financial stability is also important. We know that a large portion of our population lives in poverty in Kent County and Chestertown. And it's our responsibility as the anchor institution and one of the largest employers in the community, quite honestly, to provide jobs, to provide a hand up instead of a hand out. And not only jobs as entry-level positions, but to provide career ladders and offer opportunities for those employees to advance within their career so that, again, they become self-sufficient and can work with the community to gain their own health and wellness and thrive on their own. So these are responsibilities that we bear as the anchor institution, and our intent is to provide these components as well in the Aging and Wellness Center of Excellence. And then finally, and not last importantly, but we talked a lot about transportation in the needs assessment and in the NORC report. And we recognize that access to care is important, but it's hard on the Eastern Shore and it's hard in Kent County and Chestertown. Getting access to the services that we need, both on an emergency medical transportation basis and even those non-emergency medical transports. And then also there's those non-medical routine transportations. So when we're talking about emergency medical, it's hospital to hospital, it's ER to ER, it's getting us to an emergency facility that provides healthcare services in an emergent or admitting basis. When we talk about non-emergency medical transportation, that's transportation to and from your doctor's office, to and from the laboratory where you need to get your blood drawn, or to where the x-rays are being provided or the rehab services are offered. How does our community get from their home or wherever they are to those services and back safely and efficiently? And then the non-medical transportation is really those transportation trips to the grocery store, to your house of worship, to your beauty parlor, all things, again, that when you have access to those support services, you're healthier and you're well because you've engaged in those and they've provided you the benefit that you need. So providing that access is critical on each one of those levels. And our intent is to work with our community partners to address the gaps in each one of these. What we've done so far is to find that there is a need, but we don't have the expertise to understand what that comprehensive need is, nor to help to develop the strategies associated with them. So what we did, back to the community needs reports, it spelled out very clearly in the Kent County needs report from the United Way that said CTAA is a company that they've investigated that provides solutions for rural transportation in communities like ours for each one of these three elements. So we didn't wait until July 1st to start this. We've already engaged CTAA in a construction consultation service for us. They are in the process of completing their study. I believe we will get their draft report within the first part of May. And we'll take that report and its draft and start sharing it with our community partners and work with them to collaborate on what should our priorities be and how can we execute quickly and safely on those priorities. So we're looking forward to getting that information and to rolling up our sleeves and starting to help address the transportation needs of our community. And again, we feel like if we are successful at doing that, then we'll promote health and wellness in our community, and the Aging and Wellness Center of Excellence will thrive. So those are the 5 services and programs that make up the Aging and Wellness Center. And again, that center will complement the Maryland Rural Hospital and provide a comprehensive healthcare program, plan, vision, and help us execute on that now that we've got the framework and the vision associated with our plan. So where do we go from here? Now that we've got a high-level plan developed with some of the very specific details to help us execute, what we thought we'd do is share with you some of the things that we're working on to gain momentum and build momentum into our July 2021 timeframe. And we defined 10 items that we really wanted to work hard to try our best to complete before the July timeframe. One, to hit the ground running and gain that momentum, but equally importantly, to build the confidence and trust in the community that we're serious. You may still hear rumors that we're closing the hospital in Chestertown, and I can't do anything about that, quite honestly. But what I can do is demonstrate to you that we are serious. We've hired 2 new leaders that are going to help us with this vision. We've got board support. We've got health agency support at the state level. We've got a lot of people behind this plan. Now let's start to execute. Let's roll up our sleeves and make it happen. So these next 2 slides give you a sense of what 10 things we're working on between now and July to do just that. Try to demonstrate our path forward and build trust with you that our plan is sound and will work. So number 1 was to hire our leadership, and we've done that. I mentioned Dennis and Laura. Both will be in-house, up and running and ready to go no later than May 10th. Dennis has already been with us since April 5th. Second is to find the path and initiate the steps towards achieving the age-friendly health designation. That designation will tell our community that we understand the unique needs. It'll take us about a year to earn that designation, but we'll follow the path and the steps necessary to earn that. And again, build the confidence that we're ready for our aging community when they're in our healthcare system, and specifically in our hospital. Number 3, hire the emergency department physician with the geriatric fellowship training and really work towards that geriatric ED designation. Again, confidence in the community that we can care for all levels. We have hired the geriatrician. She'll start in August, and we expect that when she starts, I think she wants to hit the ground running already to earn level 3 designation. We believe we can earn that designation within 6 months of when she's hired. So we'll work towards achieving that goal. And again, provide those unique services in the ED that support the care and needs of the elderly. And then we'll work towards seeing if level 2 and level 1 are applicable and appropriate for us to pursue at Shore. And we'll work with our new physician to help get there if we decide it is. Number 4, let's work with Choptank to develop the federally qualified healthcare center in Chestertown and really start to focus on primary care, behavioral health, and dental services in our community. Again, all foundational to the needs of a solid, healthy, and well community. We know that that process to develop an FQHC is highly likely to be approved because we are not asking the federal agencies for contributions, financial contributions to the center. Shore is going to help offset some of those expenses with Choptank. So we believe that it's a matter of a process and an application. We think we have a strong case. And once we get the approval, we think it's likely to be somewhere between 9 to 12 months to initiate primary care services in Chestertown. And then we'll shortly follow with dental health, with behavioral health and dental health services shortly thereafter. Number 5, get the mobile wellness team up and running, hire the team members, work with the health department, and initiate a program for mobile visits in the home. We believe we can do that, to hire those team members before the end of July and start working on that plan and initiate our strategies. Number 6, initiate the recruitment for a geriatrician and as our anchor for the Eastern Shore geriatrics practice. This one's going to be a little tough, quite honestly. We've interviewed a number of geriatricians from across the country. We are looking for a geriatrician with experience and ideally someone who has built a practice from ground up. There are a lot of new grads out there that don't have experience either in the field or with developing programs. So we're being a little selective on this one, but we feel that when we find the right geriatrician who has experience and has helped develop the program, we'll find that and we'll attract that geriatrician to the Shore. So we're working hard on that. We have initiated the recruitment and we'll keep you posted as we find that geriatrician and hire them as part of our team. Number 8, implement an in-person and telehealth specialist schedule. That gets back to access to those specialists. Let's get the schedule developed as to which specialties are available and by what means. Is it telehealth or is it in-person visits? Let's define what that schedule looks like for each specialty and let's open that schedule up to the community for use. Number 8, hire the new health educator for the region and develop that annual schedule of community events. We are in the process of recruiting for that educator as we speak, and they'll connect with our community partners to develop that schedule as soon as they're hired. Number 9, get the CTAA transportation report and start working with our community partners to prioritize and implement some of the strategies. If you recall back on that slide where I showed the red and blue circles, all of the red circles started in 2021. But the transportation one is probably going to take us a little longer to implement. That may be a 3-year plan or a 4-year plan to fully implement. But once we have the information and the strategies, we'll start executing on our priorities. And then finally, to hold ourselves accountable, to make sure we stay connected with our community and listen. We're going to create the advisory council that will consist of community members, key leaders in our community, and key members who are passionate about healthcare and passionate about creating the same health and wellness in our communities as we are. And we'll form that council and we'll initiate a regular meeting before July starts. That's our goal. And I just want to give a special thanks out to our Save Our Hospital team and specifically Kay McIntosh and Margie Ellsberg for giving me a host of names to consider from their experiences in the community that we'll start with to see if there's interest there. But thank you to the Save Our Hospital group for your willingness to help support us with this advisory council. And we look forward to getting the membership defined and getting the council off the ground as quickly as possible. And that'll be Dennis and Laura's responsibility. And we'll make sure that they have the resources they need to do that. So those are the 10 steps on our journey between now and July, and again, will help us launch this program successfully. And that leads us to my last slide, which is just those takeaways again that we were hoping that you would get from today's discussion. That our multi-year plan officially does begin on July 1st, and will offer hospital-based care and services under the Maryland Rural Hospital designation with those key services and features that I mentioned on that yellow slide. And then starting now and over time, we're going to develop the Aging and Wellness Center of Excellence. I see it being a major component of the medical office building that's adjacent to the hospital right on our Chestertown campus. I see us doing renovations in that building to allow for space for these programs and really try to create a one-stop shop for our community as best we can to get access to resources to promote health and wellness. And then third, both the hospital and our aging and wellness programs will address the unique needs of our community and the elderly and vulnerable in our populations, because it's not enough for us to provide these services that for those that can afford it or those that have access to it. We've got to do it for the entire community. Just like we've done with COVID, we intend to follow that lead throughout this process as well. So we'll make sure that those vulnerable populations of our community have access to these services as well. So that's our plan. That's our intent. I thank you for your time and attention today. I know it was a lot of detail, but I hope it was helpful to frame what our thoughts and our vision is for the future for Chestertown and Kent County. And again, I appreciate your time. And Trina, I'll take it back to you for any questions and answers.
Great, thank you, Ken. As of now, we don't have any questions that have been typed in, but please, if you have anything, please type it in the square down on the bottom right-hand side of your screen. In order to give you a little bit of time, I will ask a couple questions that have been some frequently asked questions while we do these presentations. One has to do with the partnership with Kent County Health Department. Dr. Huffner, in regards to the mobile wellness team, has Shore Regional Health already started working on this?
Yes, Trina, that's a great question. The answer is yes. We have collaborated with Mr. Webb and have had meetings with Dr. Spencer, and I know that Laura and Dennis Welsh, when they arrive, will also be participating in these meetings. We've established some job descriptions and roles and have posted our educator for the area and continue with collaboration with the county health officers, the county health department, as well as other collaborators in the community that will assist in these activities.
Great, thank you. And Dr. Atha, can you tell us more about the MSTAT team and how it will help Chestertown and other facilities at Shore Regional Health? I think this program is starting in Chestertown, but then plan to move out further. Can you tell us about that?
Yeah, it's an exciting new development. Actually, what it is it's an additional resource rather than a replacement resource. So the way the team would work is it's essentially a go team on demand as needed when we have critical care patients that need additional resources. So very often, as happens now, if a critical care patient comes into the emergency department in Chestertown, the initial stabilization, of course, in the resuscitation is done by our board certified emergency physicians who can certainly handle the initial resuscitation stages with any patient who comes through. What the MSTAT team does is then it augments that. It would be a team that is then called in to continue that resuscitation on an ongoing basis as an additional resource, partly to provide an extra pair of hands and an additional level of skill, but also to free up the emergency department physician who's already there to take care of other patients who might be less ill or another critically ill patient at the same time. They would also be involved in ongoing resuscitation of a patient or stabilization if there was a challenge in getting that patient to an intensive care unit or to an additional resource such as shock trauma if this was a major trauma patient, or certainly another institution if it was pediatric cardiac arrest or something along those lines. They would be involved in stabilization for a longer period of time, and then involved in the transport of that patient as necessary. If it was a patient who requires a physician en route to augment the skills and services that EMS can provide to transport that patient. So it's based on a number of programs that have been done put in place in other larger centers in the country. The real innovation for sure that's really exciting is that we're adapting it for rural and finding that in an area that has scarce resources, this allows us to actually extend and better use the resources that we have.
Great, thank you.
Sure.
I'm not seeing any other questions. So for now, we're going to say thank you so very much for joining us this evening. Have a great evening, and we hope that you will continue to stay invested in this venture. Good night.